My name is Carly Constein, and today I will be talking about the need for trauma training in K-12 schools. So why is trauma-informed care important? Implementing trauma-informed practices in all K-12 classrooms is essential to address the diverse emotional and psychological needs of students, ensuring that every child, regardless of their background, can achieve their full academic potential in a safe and supportive environment. We need the training to ensure that we can provide this safe and supportive environment for our students. So what is trauma? According to Eller, trauma is an emotional experience that directly impacts each student in a slightly different manner, but has a definite and lasting impact on learning. When we look into the brain science, we find that trauma experienced in early childhood can heavily impact one's brain development. This affects memory, learning, and emotional regulation. It activates the stress response system, which makes it harder for children to focus on academics. It also alters brain structure like the hippocampus, which can impair cognitive functions like attention and decision making. Trauma-informed care training equips educators with knowledge and tools to recognize these effects and create environments that support students' emotional and cognitive development. So the 4 R's. The 4 R's of trauma-informed care are realize the impact of trauma, recognize the signs and symptoms of trauma, responds by integrating knowledge about trauma into policies, procedures, and practices, and resist re-traumatization. So first is realize. Upon receiving our trauma-informed training, we will learn how to realize what the impact of trauma is on students. Without knowing what the impact is, we won't know the importance of why we should care. So the next thing we'll learn is to recognize the signs and symptoms of trauma. When we are able to recognize these symptoms, we will be able to provide more help and respond, the next R, sooner. When we respond, we use the knowledge about trauma and turn those into policies, procedures, and practices that can benefit the child. And then we need to ensure that we are resisting re-traumatization as much as we are able to. We can't always resist re-traumatizing students. We can't control the whole environment, but we can control most of the classroom environment. So there are 6 principles according to Maynard. So those principles are safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. So the first one is safety. It's vital that educators and all those in position of caring for children are well educated in safety procedures, because we are the ones that are going to be implementing these procedures. Trustworthiness and transparency. The more transparent an educator is, the more likely the students will trust them. This is important because you want your students to feel that they can come to you during rough times. We'll talk about this a little bit later, but you also want to have trust and transparency go both ways with your students, because without you trusting them, they won't fully trust you. Peer support. You want to encourage peer support in the classroom, as it allows for students to start trusting those around them. Sometimes all they need is a friend, and so encouraging peer support and encouraging collaboration, which we'll get to, will ensure that you're trying to provide these experiences for them. Collaboration and mutuality. So on top of peer support, like I said, you encourage students to work together on tasks and utilize the resources around them. Once they can do this in the classroom, they can start to do so outside of the classroom. When they know how to use their resources, such as their peers or textbooks or just asking questions, then they can start to do so outside of the classroom. Empowerment, voice, and choice. You want to empower your students inside the classroom and help them feel confident and powerful outside of the classroom. You can't control anything that goes on outside of your classroom, but you can make sure that your students are prepared and confident to handle situations outside of the classroom. Cultural, historical, and gender issues. A great thing to have included in classrooms are mirrors and windows. I learned about this at a KDP panel, and I cannot remember which presenter said this, but it really stuck with me. You want to make sure that your students feel represented and appreciated when they're in your classroom. So you want to have images and books and posters on the wall that are representative of everyone, every culture, every language. You want your students to come into the classroom and feel like they belong there. So what does a trauma-informed classroom look like? I liked this quote from Berger that says, "Creating trauma-informed schools requires placing knowledge of trauma and its effects at the center of these systems." I believe that trauma-informed classrooms will always look different, but the main things that I plan to use in the classroom are a quiet corner, providing easy access to resources kids might need, like headphones or a first aid kit. I don't want my kids to feel like they have to ask me for these things that they need. I want them to be able to go and grab whatever they want or need. And an educator who is well versed in trauma-informed care. That is the biggest thing. If your classroom, if you can't provide them with the resources they need, at least you have the knowledge and you know how to handle their behavior and manage your classroom, which is important. So the benefits for students are an improved academic experience, and they get to learn some social emotional learning. So with the improved experience, trauma-informed care can improve the educational experience for students by providing an understanding of how to support students that might be affected by trauma. When you create a safe and predictable classroom environment, students will feel more comfortable and ready to engage. This is crucial for their academic success. According to SAMHSA, trauma-informed practices help students build resilience, improve self-regulation, and enhance their ability to focus and engage in academic activities. When they are in a trauma-informed classroom, they're more likely to retain the knowledge and learning that you are providing for them. They also learn empathy and patience, which can reduce behavioral issues that may stem from unresolved trauma as well as aggression or withdrawal. Trauma-informed strategies promote social-emotional learning, and social-emotional learning has been shown to improve both behavior and academic outcomes. As a result, students from trauma-affected backgrounds are more likely to succeed in school, graduate, and develop healthy coping skills. So the benefits for staff: you become better prepared for situations and you learn how to manage stress. So when you are in a trauma-informed care training, they give you the knowledge and strategies to manage difficult behaviors, reduce stress from both you and your students, and promote a positive classroom culture where educators will be able to manage their classrooms more efficiently. Educators trained in trauma-informed practices are better prepared to recognize the signs and symptoms of trauma and understand the impact that trauma has on learning and behavior. This will ultimately reduce frustration and burnout among teachers and help create more effective learning environments. Which leads me into stress management. The training helps staff manage their own stress and emotional responses when working with students who are exhibiting challenging behavior due to trauma. This support reduces teacher burnout and increases teacher retention because educators will feel more capable and confident in their abilities to support all students. When you are able to take care of yourself, you can properly take care of the children that you're working with. If you're not at 100%, then you can't expect your kids to be at their 100%. The role of school policies in supporting trauma-informed education. Inclusive curriculum. School policies should prioritize an inclusive curriculum that addresses diverse student experiences, including trauma, and integrate social-emotional learning. Discipline policies should shift from disciplinary measures to restorative practices that focus on understanding behaviors, promoting accountability, and fostering a supportive and safe environment for all kids. Schools should begin enforcing policies like these and including inclusive curriculum as part of their everyday training. Staff training and mental health support should also be provided from the schools. Policies should mandate ongoing professional development for staff to recognize and respond to trauma effectively, creating a trauma-informed culture in schools. Additionally, schools should ensure access to mental health services, counseling, and peer support programs that would help students and staff heal and thrive academically and emotionally. So, teacher training and support for trauma-informed approaches. So, what the teachers should learn during their training are how to understand trauma's impact on learning. Through proper training, teachers will be able to understand the way a child's brain processes trauma. Creating a safe and supportive classroom. When provided with proper training and adequate resources, teachers can create a space where students feel safe and secure. Building positive relationships. Trust and respect need to go both ways for students to get the most out of their academic experience. Effective behavioral management. Teachers trained in trauma-informed care are better at managing their classroom and know how to address behavioral issues more effectively. Reducing teacher burnout. Providing support and training for teachers to help them feel more confident and capable in dealing with trauma-related challenges, reducing stress and preventing burnout. We learned in one of my other classes on self-help methods, and just upon doing the few that we've learned, I have already noticed my stress and anxiety easing. So having this training would really benefit teachers. And then finally, promoting long-term academic and emotional growth. Trauma-informed training supports both emotional healing and academic success, leading to improved outcomes for all students. So, a counter-argument that some people might have would be regarding the implementation of trauma-informed care training, or the feasibility of implementation. Low-income and under-resourced districts will have an even harder time implementing trauma-informed training. They already have less resources, and so between the pressures of standardized testing and academic performance, the schools may struggle to find the means and motives to prioritize this training. However, the long-term benefits of trauma-informed care far outweigh the cons. It can lead to improved academic outcomes, which reduce the need for intensive interventions later. Also, research shows that early intervention through trauma-sensitive approaches is cost-effective, as it leads to better student outcomes and less behavioral issues. Adding on, funding and support from local, state, and federal levels can be used to ensure that schools have the resources to integrate trauma-informed care in their routines, making the investment worthwhile in the long run. To conclude, trauma-informed teacher training is essential for creating a supportive environment where students and educators can thrive. When educators understand the impact of trauma, they are able to build strong relationships and manage behaviors with empathy, meeting students' social, emotional needs and academic needs. This approach not only reduces burnout, but also promotes long-term growth. As Rita Pearson said in the TED Talk we watched during week 2, teaching and learning should bring joy. Trauma-informed practices allow education to become a joyful experience, fostering both emotional well-being and academic success for all. And here are my references. Thank you.